interview with Dr. Mauro Fradeani at the fourth Miss Global Conference here in the Bahamas. Well, thank you for your time, and please let me. I know that you gave a lecture about something that you have done recently, which is incorporated parts of digital dentistry into your aesthetic dentistry line of work, no?
Yeah. We try to put some digital work inside, and as maybe people knows, I published a couple of books that were really translated in 12 different languages, so it was really widespread. And talking about aesthetic parameters, aesthetic principles, and then also the second volume also some occlusal functional steps. Now in digital way we have put all these parameters inside together with the also phonetic analysis, and we try to combine aesthetic and function the proper way, putting all the data in data collection in the big brain of the app. The app is working only on iPad, in the Apple Store, of course, it's not selling by us. It is widespread up to now, up to 80 countries, different countries. That's incredible, but it's true. And the brain of the Apple is our brain, our knowledge, our our
experience.
This experience that we put together.
What is it called? What is the name of the app?
Like
Get Up.
Get Up. Like Get Up.
Yeah.
But the meaning is a guided aesthetic treatment application. Okay, and actually it's really nice because you can follow the questions the app asks you with a cross or with a number. You will see that the road will be green if you are in the right position, the right numbers, or orange or red. And if you're orange or red, they stop you, and then you are able to correct maybe something. And of course, you are guided 100%. At the end, even a person who is not a dentist can really do incredible work because it's guided 100% through our knowledge. To give you an example, in the case, for example, you have a kind of high smile line or average smile line. Of course, the most important step is the proportion of the tooth. The width should be 80% of the length. That is the most important step for the people looking the patient. It's a great proportion, very nice job is when you have a good proportion. But so this guide all the remaining steps, all the remaining parameters. But in the case you have a low smile line, for example, you have not two exposure at rest, at this point you don't care too much about the length and the proportion because you don't see completely the teeth. It's more important that you show some teeth during the normal life, so at rest, so you can elongate the teeth, even though they are normally not up no more than 11 millimeters, can become also 12 or 12.5 because they are not visible in terms of proportion because you have lost my line. So they become much more important, the tooth exposure at rest. So if you are able with this additional length to add some length and to show the teeth, some teeth at rest, it will be more important aesthetically than keeping the right proportion that is not visible anyway. So just to explain to you, that is made automatically by the app. You don't have to think about which one is guiding the entire system.
So it's like aesthetics for dummies?
Yeah,
Dental aesthetics for dummies? Or?
It's aesthetic for everybody, even for chimpanzee in this case. But actually, you can still do some modification, of course. You have a special point, this 9.1, it's called, where you have the final outcome by the app, but then you have all the instrument to change it, to idealize. What is even more important is for each screenshot of the app, you have like a red button, you push there, you can find actually underneath a kind of ebook explaining all the steps of this topic exactly, pushing this kind of button.
So it's a library backup?
It's a kind of library, exactly. Big